Gregg Cavaliere from Hudson Valley Bone and Joint Surgeons. Rotator cuff injuries is a common topic we encounter, or a common problem we encounter now that baseball season is present. We see a lot of throwers, and it's an issue that affects pitchers. Sometimes, third basemen, shortstop who do a lot of throwing, catchers as well. And the spectrum of disease for rotator cuff trouble is anything from tendonitis to rotator cuff tears. Generally, in the athletic population that we treat, it's more tendonitis than tears. We usually see rotator cuff tears in people that are older, although with repetitive overhead activities and pitchers in particular, you can eventually wind up with a rotator cuff tear. Typically, we treat rotator cuff tendonitis with a physical therapy program, slowing down the amount that they're doing so as not to cause pain, getting their strength and flexibility back. Usually pitchers are pitching too many innings or throwing too much, and they get tendonitis, and shutting it down, putting them on anti-inflammatories and rehabbing them is the answer. In a group of patients that doesn't work, and on an occasion you have to do surgery to help them. Cortisone is an option for some people, but not an option that I'd like to do in someone who's young. But if it's in the middle of the season and people are struggling to get back to playing, it's something we can talk about. Strength and flexibility is useful for most orthopedic injuries, and certainly that's the case for rotator cuff trouble. In the older population, or people that have had a fall, sometimes we'll see patients that have a complete tear of the rotator cuff, and that's going to result in weakness in raising their arm overhead, and pain sleeping, pain reaching, and typically that's something that we would fix if they failed the course of physical therapy. And as I said, if it's torn, generally that they don't do well without fixing them. The older population's tougher because the older you are, the poorer the quality of the tissue, and sometimes the tissue quality doesn't hold the stitches that we use to fix it, and those repairs can fail. Ideal patients are 50 to 70 years old, although we've had successful repairs in people older than that. But there is a higher failure rate as patients get older as far as repairs.